Hi, we're talking today from Toronto, and welcome to the Better Nights, Better Days Facebook Live series for children with insomnia and neurodevelopmental disabilities. Today we're going to talk about children with cerebral palsy. My name is Shelley Weiss, and I'm a child neurologist at University of Toronto, and I'm joined by Dr. Evelyn Constantine, who will introduce herself.
Yes, I'm a pediatrician specializing in pediatric sleep disorders at the Montreal Children's Hospital.
So we're going to every so often show you our website, which has information about our study, because we're going to be talking today about recruitment for our study, which is an intervention for insomnia. And the website is here, and we'll show that to you a few times throughout the next 20 minutes. So just to orient you, we're going to talk for about 15 minutes, and then we'll leave 10 or 15 minutes for questions. And you can write in with your questions. I see we have a couple people online already. We're going to talk first about children with cerebral palsy and why they have sleep problems. Then we're going to talk about sleep in general in children with neurodevelopmental disabilities. And then we'll tell you about our very exciting research that we are going to be recruiting children with cerebral palsy and other neurodevelopmental disabilities, which is going to be an online intervention for children with insomnia. So it's delivered by the internet, it's evidence-based, and we're going to be recruiting in the winter of 2019. So first, I want to ask Evelyn some questions about children with cerebral palsy and actually why they do have problems with sleep and what kind of problems they have.
Okay, great. So sleep problems are common in all children, typically developing children, as well as children with neurodevelopmental disabilities. In typically developing children, it's been shown that up to 25% of children have a sleep problem, so 1 in 4 children. In children with neurodevelopmental disabilities, that number goes up to 90% of children have any type of sleep problem. And specifically with cerebral palsy, it's been shown that 36 to 90% of children have insomnia. So children with cerebral palsy and insomnia.
Thanks. So I'm sure people are watching, they can relate to that. Unfortunately, if you have a child with a neurodevelopmental disability, either you or you probably know other parents that unfortunately do have problems with getting their children to sleep through the night. Mm-hmm. So we're going to talk about cerebral palsy. Why do children with cerebral palsy specifically have trouble with sleeping?
Right, so children with cerebral palsy are having the same type of sleep problems than any other child who's typically developing. So breathing disorders like obstructive sleep apnea, as well as behavioral insomnia. In particular with children with cerebral palsy, they may also have pain related to contractures or muscle spasms, and that could lead to disrupted sleep, disturbed sleep, awakenings at night. And sometimes they have to change positions in bed. So these can cause some sleep problems. Other things that can also be associated are medical conditions like epilepsy that can also wake them up at night.
And what's the most common problem in children with cerebral palsy in terms of sleeping problems?
So that's a good question. It's actually like all other children, it's behavioral insomnia. So difficulty falling asleep and difficulty maintaining sleep. So behavioral insomnia is the most common sleep problem in children with cerebral palsy.
And that's why we've developed this research that we're going to tell you more about. And just for anybody who joined recently, this is our website if you're interested in learning more about our study for children with neurodevelopmental disabilities and insomnia, and whether or not your child is eligible.
And so, yeah, maybe we can move to the next part. So, Shelley, maybe you can tell us a little bit about sleep in general and what makes us sleep and what keeps us awake.
Sure. So I'm just going to talk for a couple minutes about sleep, and I'm going to be specific about why children with cerebral palsy may have trouble with what you've just heard is behavioral insomnia or trouble falling asleep, sleeping through the night or waking up too early in the morning. So there are two important processes that keep us asleep at night. One is called the circadian rhythms. So we have many different rhythms in our body that are about 24 and a half hours every day. And every day we bring our bodies back to staying on a 24-hour day. And the way we do this is by something called zeitgebers, or cues to our circadian rhythm. So some of the important cues are things like sunlight in the morning, darkness at night, the melatonin secretions in our body, or the release of melatonin with darkness, exercise. And so children who have specifically cerebral palsy, who maybe it's more difficult to have your child go out and play in the morning, get exercise, get sunlight, these lack of social cues or zeitgebers, or biologic cues or zeitgebers, make it harder to stay on a 24-hour cycle. The second problem is something, a process called the homeostatic process. So you can think of this like during the day, you stay awake and you build up pressure, kind of like a spring. It gets tighter and tighter the longer you're awake during the day. And at night, when you fall asleep, this pressure dissipates. So this homeostatic pressure builds up every day and dissipates through the night. If you have children, if you have a child with cerebral palsy who, let's say, after physical therapy or occupational therapy, they're very tired and they need to nap during the day, but they're actually school age and they don't really need a nap, this pressure that's supposed to build up all day kind of dissipates a little bit during that nap, so it's harder for them to fall asleep at night. These are two of the problems I just discussed quite quickly, but that we go over in detail in our research intervention called Better Nights, Better Days for Children with NDD, which stands for Neurodevelopmental Disabilities, that you will learn if you decide to participate and are eligible for being in the study.
That's great, Shelley. And how can you tell us how children with CP have problems? Why do you think children with CP have problems throughout the night, specifically in that homeostasis issues that you talked about?
Sure. So the children with cerebral palsy and other neurodevelopmental disabilities, in terms of the homeostatic pressure, may have problems because that pressure to sleep is lost a bit if they have a nap during the day. And so we have to look at children's 24-hour day and make sure they're getting enough exercise, sunlight in the morning, darkness at night, to keep the circadian rhythm in check, and that they're staying awake but going to bed at a proper time regarding the homeostatic pressure. And I'm just going to take a break for a second for people who just joined, because I saw a few people have joined recently. This is our website if you want more information about our research and if you want to sign up so that we can contact you for potential recruitment when it opens in the winter of 2019. I also want to tell you that we are just going to talk for a few more minutes, and then we're going to let people ask questions and we'll answer them. Great. So Evelyn, tell me a little bit more about the research. Why did this group of Canadian researchers get together to develop this intervention for children with insomnia and cerebral palsy?
Right. So, well, as we were talking about, behavioral insomnia is very common in children, and especially common in those with neurodevelopmental disabilities. So we wanted to create this project and this platform to help parents and caregivers of children with neurodevelopmental disabilities. So we assembled this group together across Canada to bring in the expertise on sleep and neurodevelopmental disabilities, to create this online platform and to use online technology as a way to reach out to all, hopefully many people across Canada, when resources are, potentially limited in each province for evidence-based sleep medicine care. So we thought this would be an innovative way to to reach out to all of these individuals. Yeah.
Great. And I just want to mention Dr. Penny Corkum from Halifax, and the Corkum Labs are the main person who's running the research, who's a co-principal investigator and doing a lot of work to get this research going.
And who created Better Nights, Better Days.
Correct.
That's ongoing currently.
Correct. So for people who don't know about Better Nights, Better Days, this Better Nights, Better Days for children with NDD is a modification of a previous research project that Dr. Penny Corkum is the principal investigator of, called Better Nights, Better Days, which was developed for typically developing children. So let's just talk a little bit more about Better Nights, Better Days, NDD. So do you want to just tell me a bit about it, how we're going to recruit, what kind of children are eligible for the study?
Yes, so what we've done as a group is with Penny and the rest of the group, we've tailored the Better Nights, Better Days online modules and platform to with modifications for children with neurodevelopmental disabilities. And essentially the recruitment, we'd like to have, we're targeting children who are 4 to 10 years old with cerebral palsy and other neurodevelopmental disabilities, and with insomnia. So any type of difficulty maintaining or initiating sleep during the night. Parents can register online and get more information about this, and they would get the intervention, which is this online strategies and modules that parents can read and can be part of.
Great. Sounds exciting. And I'm going to tell you a little bit more about it. So Dr. Constantine and I are part of this big team that are developing this project. So it's called a randomized control trial, which means that if your child is eligible for participation, that you will be randomly chosen, so kind of like flipping a coin, whether you actually are able to receive the intervention and be part of the study, which you can read more about, includes answering questionnaires, working through the study, if possible, getting your child to wear something called an actigraph, which looks like a watch, but is a motion detector that tells us when someone is awake or asleep. And if you are randomly chosen not to get the intervention, you still, at the end of the study, will actually receive the links to go through the intervention. So we're going to, first part of the research is to see whether our intervention is effective. But the second part is to allow all parents who are eligible and are recruited to actually participate in the research. So I guess it sounds like a lot of work. It's a lot of work bringing this together. And we're looking for a lot of children and families to participate. Anything else you want to mention about sleep in children with cerebral palsy or the research? And then we'll see if anybody has any questions. Maybe just while you're thinking, about it, I'm going to show the website again. Whoops, upside down. Here's the website if people are interested in finding out more information about our research, Better Nights, Better Days for children with NDD. Maybe I'll just mention today we're talking about cerebral palsy, but we're also recruiting children who have autism, ADHD, fetal alcohol syndrome disorder, and cerebral palsy. So those are the 4 groups of children we're looking for to recruit for this study. Yeah. Anything else you want to mention?
No, I think that was pretty much what we wanted to discuss.
Okay.
If there are any open questions, we're open to answer them.
Okay, so we can see that we have quite a few people who are listening to our presentation. Neither Evelyn or I have ever done Facebook Live before, but we'd be very interested if anybody has any questions. And while we're waiting for the questions, we'll just see from our notes if we have anything else we want to talk about.
There is one question that I wanted to maybe ask you and see if maybe some parents have questions about what's the time commitment for in participating, and if it's an online module, is it something that they have to do in one stretch, or can they go in and out of the module as time permits?
Sure, that's a great question. So the the parents, if you participate in this project, you will have 8 to 12 weeks to work through the intervention, but actually access to it for longer than that. And there are 5 modules, which start with just information about sleep, and then how to get your child to bed, what happens when they wake up in the middle of the night, how to keep them sleeping, and then just kind of looking forward. There is quite a bit of information. We have graphics, we have videos, we have homework, we have parents have to complete sleep diaries. But it's a great question because you don't have to do it all at once. We know obviously parents are very busy with their children and their work and their activities. So you will be able to stop and start and work through the intervention. And we are very optimistic that this intervention is going to help your child to learn to sleep better at night.
Well, in fact, behavioral interventions is the mainstay. It's the gold standard. It's the first line, treatment for children with insomnia. So even before medications and any of that, that's really the most common treatment. So
yeah, that's a good point. That's a good point. And maybe the other thing I'll just say is that even if children have problems with the other things that we talked about, with seizures, sleep apnea, which obviously all need to be treated, there may also be a component of behavioral insomnia. So it's not one or the other. Often there are many reasons that children don't sleep well. So I think now we're going to see if anybody has any questions. I think we just got a pin that somebody may have a question. Hold on a second. I'll just put our website up again while we're thinking about it, waiting for the questions. So I think, Evelyn, somebody wants to know why we're only allowing children with mild to moderate cerebral palsy into the intervention.
That's a good question. Our research team talked about this together, and essentially children with more severe forms of cerebral palsy may have more complex medical conditions that require, that could be helpful with, that could be treated with some of these behavioral interventions, but we think that those children with more severe forms of CP would require a bit more complex treatment plans. So for this part of the study, we decided to include those children with more mild forms of CP. In addition, because, as you mentioned, we're recruiting children with ADHD and autism and
fetal
alcohol syndrome, we wanted to ensure that the children did not have other complex medical disorders. But we, potentially this could be future project.
And I guess another question is why we actually are only using these 4 groups of children. I'll just let you answer while I look at the other questions. As a group, we decided that these were the more common conditions, or children with these conditions were more commonly having behavioral insomnia, and so we decided to involve these 4 children with these 4 conditions. Okay. And possibly if the intervention works, because the modifications are for children with these 4 disorders, we may in the future be able to make modifications for other children too, hopefully.
Exactly. Yes.
Okay, so we have a question from Emma. Thank you, Emma. Emma has a 2.5-year-old daughter who doesn't nap, and she's having a lot of problems sleeping. She wakes up through the night and sometimes for 1 or 2 hours, and also wakes up before 5 every morning. And when she wakes up, she says she doesn't like sleeping. Do you want to tackle this, or do you want me to?
You can start if you like. This is
sure.
Very common. It's a very common
So
situation.
thanks for your question. I assume from your note, Emma doesn't have cerebral palsy, but we are also sleep physicians, so we can basically answer any question about childhood sleep. So I can't give you anything specific because obviously I don't know Emma or if she has any other healthcare needs or any other cognitive issues or behavioral issues or anxiety. So I don't want to answer specifically, but I think that the best answer is that, as Evelyn said, 1 in 4 parents will endorse that their children have problems like you have described in Emma. And in general, this is usually due to behavioral insomnia. So children who don't have the ability to settle independently at night, sleep on their own, settle back to sleep when they wake up, because we all wake up 4 to 6 times at night for a very brief time. And then sleep through till the morning. So it would be important for you to see Emma's own primary care physician and make sure there's nothing else. You know, she's not snoring, she doesn't have sleep apnea, her iron isn't low, so she's having too many leg movements at night. And then if you have ruled all these out, then to talk with the primary care physician about how to teach Emma to settle better at night. There are a lot of resources which are available on the internet through different websites, such as the Canadian Sleep Society or the National Sleep Foundation. There are a lot of books about children's sleep. So I don't want to answer specifically about Emma, but in general, I would be optimistic that you will be able to help Emma sleep better.
And maybe I'll just add a couple of things too. Is I agree with Shelley. I'm not going to make anything specific, but in general, some tips are keeping everything regular, routine, ensuring consistency in the cues, and also just making sure that the sleep environment is the most ideal for sleep. So when it's nighttime, sort of blackout shades to ensure that there's no light seeping in, especially if she's waking up before 5 in the morning. That could be one easy technique to do, but definitely seeing your pediatrician and making sure other issues aren't there. But regular and bedtime routines are really key.
Yeah, I totally agree. Somebody else wants to know why we aren't using medications like hypnotics, Gravol, Benadryl in our intervention.
Well, the plan was, since the first line treatment is behavioral interventions, we wanted to, and it's non-invasive, meaning that there's no invasive, no invasiveness or harm. That really is the first line treatment. So we wanted to explore that first, make sure that, like we talked about, the sleep environment, sleep routine, all the behavioral behavioral techniques and the sleep environment is first enhanced, improved before we, before the next step of medications are looked into. And if children are on these medications, then we have different criteria whether they can or cannot be part of this study.
I totally agree. So we won't be enrolling children who are on any kind of sleep-inducing medication. They can be on other medications, like if they have epilepsy, they could be on anti-epileptics, as long as we don't expect them to change in the 6 months of the study, 6 to 8 months. But I totally agree with you that this is why we have all come together to develop this intervention, because we're pretty confident that with these behavioral techniques, you can teach your child to sleep through the night. And that's why we call it Better Nights, Better Days. So you and your family will have better nights and better days. Great. So do you have any other just questions about the study while we're seeing if there are any other questions from our audience? And I'll just put this up one more time. Here's our website. If people want to go to the website and learn more about the study and whether they're eligible and their child's eligible.
So Shelley, you mentioned earlier about actigraphy or an actigraph. Do you want to maybe talk a little bit more about that?
Sure. So these days it's pretty simple to talk about actigraphs because, you know, pretty much everybody wears a Fitbit. Not everybody, but a lot of people. So a Fitbit is, you know, it looks like a watch and you wear it and it tells you how many steps you're taking and it's more about your exercise. And an actigraph looks just like a Fitbit, except that it's a more sophisticated kind of computer technology that by knowing when your arm is moving or not moving tells you whether you're sleeping or not. One thing about our study is if your child can't wear a Fitbit for whatever reason, they won't be able to cooperate or you're worried they're going to lose it, we still will be able to enroll children in the study, but we do want to try and get the children to wear the actigraph because it's a very objective way of monitoring sleep. So maybe if we don't have any questions, we want to thank everybody for listening and just see if we have any, do you have any final words to say about our research project?
Well, it's definitely exciting. It's Penny and the group have been assembled together to bring the expertise from across the country in different fields of research and of health professions. So we have neurologists and sleep physicians, psychologists,
OT,
right?
Nurse.
Yes.
Yeah.
So really across all healthcare professionals just to come together to bring all the expertise in and help families with children who have insomnia and who have neurodevelopmental disabilities. So we thank you for the time that you've shared with us, and maybe we can show the website one last time. Do you have any final
no, we're very excited to start our project. Here's the website again, and we will keep your name if you want to register on the website. There's no, you don't have to be part of the research. You can always say no at any time. But if you are interested, we'll let you know when the study is starting, and then we'll send you a questionnaire and see if your child is eligible for recruitment. So I hope everybody has a happy holiday and that you've learned something about sleep and children with cerebral palsy and our research, Better Nights, Better Days.
Thanks.
Bye.
Bye.